Hey, Margie here. Did you know that there's animal research showing that Lyme disease can cause bone loss? Lyme disease is something we've all heard about, but how many of us really know the implications and that even if we had it as a child, it can resurface later in life? There's so much to learn about Lyme disease, and I'm always big into really digging deep and seeing if indeed this could be the root cause of our symptoms. So I'm really excited because our special guest today is Dr. Darin Ingels. And Dr. Ingels is a licensed naturopathic physician, author, international speaker, and leading authority on Lyme disease. He's a former Lyme patient who overcame his own 3-year battle with Lyme disease after having failed conventional treatment and became progressively debilitated. Dr. Ingels found that proper diet, lifestyle management, and natural therapies worked with his body to heal. And so he decided to apply what he learned about his own healing journey to his Lyme patients and found they recovered faster and with less side effects. Dr. Ingels has now treated more than 8,000 Lyme patients using his novel approach, many who have gone on to live healthy, symptom-free lives. And he's been featured on WebMD, MindBodyGreen, BeWell, ThriveGlobal, Motherly, and Dr. Ron Hoffman's Intelligent Medicine podcast, and is the author of the Lyme Solution, a 5-part plan to fight the inflammatory autoimmune response and beat Lyme disease. And I'm really excited about today's talk because we delve into it. So many myths and so many misconceptions, but the good news is there's a lot that can be done. So stay tuned. Welcome, Darin. I'm really happy to have you here on the podcast. This topic is so important, something people really don't have a good handle on, and something that can completely change their life if they had the information. So, welcome.
Oh, well, thank you so much for having me, Margie.
So, before I always love to hear the backstory because, how did you specialize in Lyme and become such an expert? Like, what caused you to do that? So, maybe start there.
Well, that's an easy one. I got Lyme disease. I was living in Connecticut. And for people who don't know, Lyme disease is named after Lyme, Connecticut. That's where they originally discovered the illness back in the late 1970s. And about 2 weeks before I was opening my own practice, I got bit by a tick and I had classic Lyme disease. So I had all the symptoms you read about in a medical textbook, and I identified it pretty quickly and started treatment right away. And really, 4 days into antibiotic treatment, I felt perfectly fine. But I think the timing of when I got bit relative to when I opened my own business, I got bit, 2 weeks before I started my own practice, and for anyone who's ever run their own business, you know what it's like when you get started, you end up doing a lot of the work yourself and couldn't afford staff at the time. So, and I was working 6, 7 days a week, 8, 10, 12-hour days. And 8 months into that schedule, I started to relapse and had symptoms again. And I identified that, okay, I know I'm having a relapse, went back on antibiotics. It didn't get better after a month. I changed antibiotics and I didn't get better after another month. And then I started working with a local Lyme doctor I knew. And, 8, 9 months into oral antibiotics, I was getting worse and worse. My gut was a mess. I had lost 30 pounds in about 6 months and I just felt terrible. And I was fortunate to have known of a doctor in New York City who's a Chinese medical doctor, but works as an acupuncturist. And I had known of patients that had seen him for Lyme, and I saw him and he started me on a regimen of Chinese herbal medicine and acupuncture, and a lot of it too, I think, was just a wake up call that I really wasn't taking care of myself the way I should have. I wasn't eating well, I wasn't sleeping well. And so once I kind of put all the pieces together, within a month of that protocol, I was 85% improved. So it took another 2+ years after that to really feel like I got, my brain back, my energy back, and I was really back to myself. But I did get to a point where I was really 100% symptom free. So I really just started applying everything that I did for myself to my own Lyme patients and found that, it really just wasn't about killing the bug. It was all these other factors that sit in the background that really control how your immune system functions. And again, it's diet and gut health and sleep and all these other pieces of your terrain that are really important for overcoming really any chronic infection. For me, specifically Lyme disease. But now having applied that to 8,000 plus Lyme patients, I see that this is really a path that people who have Lyme disease or any of these tick-borne illnesses can follow and really get to a point of getting well again. So yeah, it was really my personal experience that kind of led me to do what I do today.
Wow, there's so many interesting things about what you said. The fact that it's not just a simple fix with antibiotic, or even if you feel better, years later, it might come back if your terrain, if you're not taking good care of yourself, or if your immune system isn't whatever may be the reason. But I don't think most people think about that. And at that point in time, or you're not going to have the bullet, you're not going to have the same signs. Is that correct? Like when it reoccurs, do you have that same bullseye? Do you have the same, that's going to tell you that you have Lyme?
Yeah, well, the symptoms of Lyme are really interesting. If you read again a conventional medical textbook, you'll see that Lyme, this classic bullseye rash, it looks like a target. So if you've ever seen, the logo for Target, and it looks kind of like that, where it's these sort of alternating red, white concentric rings that tends to be flat and spreading. That's very classic for Lyme disease. Migratory joint pain is another symptom that's very characteristic of Lyme disease, where one day it's your right shoulder, the next day it's your left knee, and then right ankle. When you kind of feel this pain moving around from joint to joint, that's very unique to Lyme disease. Beyond that, there's over 100 different symptoms associated with Lyme disease. So, fever, chills, swollen lymph nodes. I mean, you can feel very acutely ill with Lyme disease, which is why sometimes it gets mistaken for a lot of other acute illnesses. With the fever and the chills and the headache and the joint pain and numbness and tingling, or what we call neuropathy. Fatigue is a big one. I mean, it's kind of interesting, of course, coming out of the pandemic of COVID, there's so much clinical overlap between COVID-19 and Lyme disease. A lot of us in the Lyme community kind of felt like, gosh, was COVID really just kicking up a lot of people's latent Lyme disease that they didn't know they had because the symptoms are so similar? But, this is where it gets to be really tricky with the diagnosis, is that the symptoms overlap with so many different things. In fact, they actually call Lyme disease the great imitator, the great mimic, because it looks like so many other illnesses. And a lot of people, if they don't get the bullseye rash, if they don't get the migratory joint pain, it's really easy to gloss over it and think it's something else. And a lot of people, when they do, lab testing, everything kind of looks good on paper. And so it's not uncommon that people that get Lyme disease, if they don't get identified quickly, go months or even years before they finally come across getting a proper diagnosis.
Well, let's talk about that. How accurate is the lab testing? Because that was the standard of care. I know I've had children who've had Lyme disease and, oh, okay, you test positive. But if you didn't, they didn't say that you could have Lyme disease. So let's just go into that for a minute, because there may be people listening who have Lyme disease, but their test was negative. So they just moved on. Can you just address that?
Yeah, I mean, in a nutshell, Lyme disease testing is something short of terrible. So I was a clinical microbiologist before I was a doctor. I used to do this test for a living, and it's got a very poor sensitivity. And what that means is that a good lab test, you want to be really sensitive, which means if you have the disease, what is the likelihood the test is going to pick it up? And a good lab test will be about 96% sensitive, at least somewhere in the high 90s. But when you look at the research on the Lyme test that's currently available, it's somewhere between 43 and 46% sensitive. So literally misses half the people that have this illness. That is a terrible test. And what's really interesting is that, this test was never actually designed to be diagnostic. It was actually designed to monitor people that had known Lyme disease. So these are people that had the bullseye rash and all the classic symptoms. They wanted a way to kind of monitor them. So if you go to the CDC's website and you read about Lyme disease, it even says on their webpage the diagnosis is not based on lab testing. It's really based on clinical signs and symptoms, particularly if you live in an area that's endemic for these deer ticks that carry Lyme disease. So the test kind of helps confirm our suspicion that that's what's going on, but a negative test doesn't exclude the possibility of having Lyme disease. And to kind of complicate it more, that we know a lot of ticks, particularly where you live up in New England,
Yeah.
30+% of the ticks there that carry Lyme also carry something else. So if you get bit by a tick, you might get Lyme, but you might get something like Bartonella or Babesia or Anaplasma. Every time I go to a Lyme conference, I swear there's like 5 more things we've learned that ticks carry that we have to worry about. So often when we're doing testing, we're testing for this litany of all these different infectious agents that we know these deer ticks carry. And it's not always just Lyme, but Lyme by itself, I think it tends to be one of the harder ones to pick up on lab testing. The organism itself, even though it's a bacteria, it almost behaves more like a virus, and it can evade the immune system. It can hide inside of our own cells and tissues. And that's why, again, we see people that could have Lyme for many, many years. And it's just the inability for the immune system to react appropriately. And certainly, again, if your immune system isn't making antibodies, because the test that we're doing is measuring antibodies against the organism, that lack of response is going to look like a negative test. So we've got all these variables that, contribute to, what would really comprise a positive test. But I think it's important for listeners to understand that, if you've been tested for Lyme and your test came back negative, unfortunately, it doesn't exclude the possibility. Now, there are some labs out there that really do specialize in tick-borne illness. I think they do a better job of picking up on Lyme disease than your standard reference lab like Quest or LabCorp. So we use labs like medical diagnostic labs, which is in your home state of New Jersey and Hamilton, New Jersey. They do great testing. They bill insurance. IGeneX out of Palo Alto, California is another great lab. Unfortunately, unless you have Medicare, they don't bill insurance, but there are a few labs out there that really do high quality testing that if you've been through your conventional reference lab and it looked negative, you might talk to your doctor about running it through one of these labs because you might get a different result.
Okay. And so in terms of figuring out when someone comes to you and they don't know if they had Lyme and their tests are negative, are there other things that you do, or is it really just based on signs and symptoms?
Well, signs and symptoms tell us a lot. Dr. Richard Horowitz, who's a Lyme guru out of upstate New York, he developed a questionnaire. It's called the MSIDS. And this has actually been validated in research. So it's a symptom questionnaire, and you go through and you check off your symptoms, and it gives you a score. And if you score high on that questionnaire, that is pretty indicative of having Lyme disease. And the fact that they've actually done studies to show that that is pretty much as reliable as the blood test, that's something that anybody can do. That questionnaire is available online. I wrote a book called The Lyme Solution. I kind of did a modified version of his questionnaire, and we find very similar results. So, a symptom questionnaire can also be helpful in identifying if you have Lyme.
Okay, so the person finds out they have Lyme and they've already gone through the course of antibiotics because, well, let's actually go before that because that's the conventional treatment, on antibiotics. That one doesn't work next to antibiotic, which we know there's unfortunately so many side effects, and the side effects affect people with osteoporosis, everybody, in terms of really affecting their gut and affecting so many other things. So, what have you found to be most effective in terms of the treatment?
Yeah, it's probably, someone with really acute Lyme disease. I mean, I think this is a case where antibiotics are appropriate. If you do catch it early, there's good evidence that they can work. I think the deficit with the antibiotic therapy is that the treatment tends to be too short. What's really kind of unique about Lyme as well is that it's a very slow growing organism. And if you look at most bacteria in your body, most bacteria replicate every 10 or 20 minutes. Lyme replicates every 1 to 16 days. And if someone gets tuberculosis, which thank goodness we don't really see much anymore in this country, but if you get TB, they'll put you on a triple antibiotic cocktail for 9 to 12 months. And the reason they put you on such a hardcore protocol is that tuberculosis is a very slow growing organism. Well, TB replicates every 15 to 20 hours. Now, relative to every 10 to 20 minutes, that's very slow, but Lyme replicates every 1 to 16 days. So, why we're content to give people 2 or 3 weeks of a single antibiotic for Lyme, yet we'll give people three hardcore antibiotics for TB for 9 to 12 months, it doesn't really make a lot of sense. So, I think where we run into some issues with some folks is, they find out they have Lyme disease, they go on 3 weeks of typically it's doxycycline, sometimes it's amoxicillin, and at the end of 3 weeks, the doctor says, well, you did 3 weeks, you're just done. I'm like, well, if Lyme replicates every 1 to 16 days, you may have only had one replication cycle during that time frame. And what's interesting about doxycycline too is that it doesn't actually kill anything. Antibiotics like doxycycline are what are called bacteriostatic. They stop the organism from replicating, but it doesn't actually kill what's there. So, it only works really when the organism's in a replication phase. So, this is where, I think most of us in the Lyme world feel like if you're going to use antibiotics, particularly doxycycline, 6 weeks is probably the minimum. I know a lot of doctors that will do it for 8 weeks. And although it is still longer term antibiotics, I think we feel like we can use probiotics and other things to help protect your gut during that time frame. But, I kind of think that was my own situation. It was the perfect storm of I got the infection, I had a lot of stress, but I think because I only did, even though I felt better after 4 days of antibiotics, I still stayed on the 3 week course of doxycycline. And in retrospect, it probably just wasn't enough. Had I stayed on it for 6 weeks or 8 weeks, would it have been in a different outcome long term? I mean, who knows? But my experience having worked with other patients is that if you do a longer course of treatment, the likelihood of it becoming a more chronic problem goes way, way down. And again, there are some people where, antibiotics aren't the best solution. In my practice, I use a lot of herbs. And for anyone out there who feels like herbs aren't as effective as antibiotics, really don't know anything about herbs. They are really effective. They're very potent. I have some people that do one drop of one herb and they start to get this massive die-off reaction. So we know clinically that, depending on your sensitivity level, that herbs can be, very profound. And again, in having done this now for 23 years, I've probably written less than 10 prescriptions for antibiotics. So I use herbs
Wow, that's
primarily.
fantastic.
Well, I think, the beauty about herbs too is that they do more than just kill the bug. So, they're anti-inflammatory and they help promote better circulation and they help support your immune system. They help support your gut. So we can combine herbs in different ways for each individual to find out really what does their body need to help, overcome their illness. Because with Lyme, again, there's a collection of different symptoms that one person may have more joint pain, one person may have more neurological problems. So we can really change the herbal protocol around so that we're really kind of targeting what's affecting that person most. And again, having done this for a long time, I find that it's a very clinically effective way to manage Lyme disease. Like you mentioned, there's less negative impact on your gut microbiome, your mitochondria. A lot of antibiotics damage your mitochondria, and that's the part of the cell that you need for cell repair. That's what helps literally create energy. So if you're someone with chronic fatigue and you're on a lot of antibiotics long term, it's going to be really hard to get your mojo back because you've got this thing that's constantly undermining, that part of your body that you need to, literally make energy. So, herbs just have so many wonderful aspects to them. And again, I find by and large, most people tolerate them very well. And we get the clinical benefit without all the negative side effects.
Well, that's wonderful. You mentioned something else that I think is really important for everybody listening. The terrain, so why don't you go into that? Because two people taking the same regimen and one is doing all these things, then taking care of themselves, and one isn't, have very different terrain. Can you explain how that impacts Lyme as well as just overall healing too?
Yeah. Well, I think if we, again, kind of think about what's gone on with the pandemic, why did some people who get COVID get a sniffle and other people died? We saw this gradation of how people were impacted. And when we look at any germ, why do we see such different results in people if the germ is essentially the same? And again, it kind of comes down to the terrain. I mean, that's everything about your body. So that's your diet, that's your gut health, that's your cell pH, that's your sleep, that's your mental emotional state, that's past trauma. There's all these things that impact your terrain that allows, your body to function the way it's supposed to. I think the beauty of being human is that it is built into our DNA to heal. The body, knows when there's a problem and has these, mechanisms that are automatically built in to repair that damage. So I mean, short of severing a spinal cord or something like that, most tissue in our body can repair itself. It's just there's something that's an obstacle in the way. So is it infection? Is it toxicity? Is it trauma? That's where, we as practitioners have to go through and kind of walk you through those different stages and like, where is the obstacle? Where is that deficit? Where is the body not functioning the way it's supposed to? So when we're doing sort of terrain analysis, often we're doing looking at your stool, we're looking at, your urine, we're looking at your saliva, we're looking at all these different, parts of your body that give us information about where something might not be functioning as well as it should. For me in my practice, particularly with Lyme patients, is that, diet and gut are really the first places to start. If you've got a lot of, gastrointestinal problems, your gut accounts for up to 80% of your immune system. So if your gut's not functioning well, your immune system's not going to function well, which means that your ability to manage any infection potentially is compromised and your disposition towards autoimmunity can change. And we know that a lot of folks with autoimmune disease often have some sort of underlying infection that triggers that. So, making sure that the gut is healthy, that you're having regular, healthy, bowel movements and you're not getting, reflux and heartburn and all these kind of things. And of course, what you put in your mouth makes a difference. Diet is key for, again, I think any chronic illness and certainly for, the osteopenia, osteoporosis folks, nutrition is essential for building bone. Again, the body has the DNA to, make sure that your body models bone correctly. So, we sit down, we always have a deep conversation about, what you're eating, making sure that you're putting the right, nutrient dense foods in your body to help, with tissue repair. And again, that has such a huge impact on, getting your terrain set. So diet, gut, and then kind of maybe beyond that, we get into more detox stuff. All of that's really essential for having a healthy terrain.
It's interesting because so many of the root causes of what you're talking about are also root causes of osteoporosis and bone loss and autoimmunity. And so, same type of thing where we need to really delve in and figure out what's going on if you're really going to, heal as well as, have strong, healthy bones for the throughout your life. So it's very similar, but something really interesting I wanted to talk about because there is some research on animals where there's a correlation between Lyme disease and osteoporosis. And so why don't you, and bone. So why don't you just share that? Because
Yeah, there was some interesting research. It was done in mice, which aren't humans, of course, but it was interesting that when the mice were infected with Lyme disease, it accelerated bone loss. So their disposition towards osteopenia, osteoporosis was much greater. I can say again, having worked with humans, I don't do a lot of work with mice, but given I do see that in my clinical practice, and I think it's compounded by the fact that a lot of people, when they get Lyme, particularly if they have arthritis or some sort of joint problem, they become less physically active. So if you've got a process now that's accelerating bone loss and you're not doing the things that we know build bone, the net effect is that whole process just kind of, skates away and things can get out of control very quickly. And I've had a few very young people that, for various reasons, end up getting a bone scan, and we find out that they've got pretty significant bone loss. And these are people in their sometimes even 20s and 30s. So it's not, I think maybe the population we generally think of being maybe a little bit older before we start to see significant bone loss. In fact, I had a young man, he's in his late 20s, that had a DEXA scan for other reasons. And they found out that he's, osteopenic, almost osteoporotic, and everyone's kind of dumbfounded, but he does have Lyme disease. Now, can I prove that Lyme was what caused his bone loss? No, but it's kind of odd, right? To see a young, healthy male having that kind of bone loss. So I think it's important, for anyone out there who knows that they have bone loss. Again, particularly if you've had this collection of arthritic symptoms, potentially neurological symptoms, that would be a red flag for me to, want to pursue looking into Lyme disease and other tick-borne illnesses as a potential underlying cause.
because that's the thing. So often with osteoporosis, as you know, unfortunately, people are just put on medication and really not even looking at what could be the root causes. But that's Lyme disease could be something that just nobody's thought about, or it's not something that's on someone's radar. That's really why I wanted to have you on, because people need to know this. This is, there'll be people listening. Oh my gosh, that sounds like me. No one's been able to figure it out. And here you are. And so, but the other thing is you see people all over, correct? Now that you have a virtual practice.
Yeah, well, I think that's one thing the pandemic kind of did for all of us, right? Is that it opened up this world of, virtual medicine. So yeah, we work with people from all over the world, and it's always a kind of maybe shocking to me the number of people I find that have had symptoms for years and no one it just never crossed their radar. But I'm not. I guess I'm not surprised. When I moved out to California, so I lived in Connecticut for almost 20 years. I relocated out to California about 4 years ago. And when I came out here, it was amazing that California doctors were really quite ignorant to Lyme disease. And I've had doctors tell patients there's no Lyme disease in California. I've had one doctor tell my patients there's no deer in California, which is crazy. We have deer crossing signs all over the place. But there's really this huge lack of understanding of where Lyme exists. And the reality is that, at least in the United States, it's been reported in all 50 states. And I know, even prior to the pandemic, people did travel. So even if you live in a state where you don't necessarily have a lot of deer ticks, you could have gone someplace where there are, and your exposure may have occurred outside of your home state. But I've seen people, in Texas and Arizona and these states where again we don't typically think of being Lyme endemic, and people test positive for Lyme and they've never really left their state. So if you're in a state that's not typically known for Lyme, and your doctor tells you, well, we don't have Lyme here, that's unfortunately not true. And you need to go find another practitioner that can help you figure out if that's what's going on.
How else besides the deer tick, or is because I know there's other ways. That's not the only way that it can be spread.
Well, deer ticks, I think, account for the overwhelming majority of cases of Lyme. Is some evidence. There's some studies out of Europe that suggest that mosquitoes, fleas, other biting insects might carry Lyme. We know that other biting insects can carry other diseases, though, that look like Lyme too. Like we know that fleas can carry a bacteria called Bartonella or lice even. So uh, some of these other biting things can carry other stuff, but for Lyme specifically, again, other biting insects may be. However, the research is not fantastic. We know now there's a few studies out showing that mom can pass it if she's pregnant down to her baby. And that
Wow.
moms that have Lyme disease when they're pregnant, their babies can be born with birth defects. They can be born stillborn, and or we might even see early developmental delays in kids that have Lyme disease. So mom to baby transmission definitely happens. The one big question that no one's really been able to clearly elucidate is it sexually transmitted? And there's only unfortunately been really one study that I've seen. Dr. Ray Stricker up in the Bay Area of California did this, and he basically measured the semen of men, the vaginal secretions of women to look to see if he could find evidence of Borrelia. And I think both in men and women, it was like the low 20 percentage, had evidence of Borrelia, but they didn't. I mean, you can imagine ethically it would be hard to, potentially infect someone, although you could do this very easily in animal studies to show that it's sexually transmitted, but no one, as far as I know, has done that research yet. So I think a lot of people in the Lyme community feel like it's possible, but not probable. The vaginal pH is very acidic. It's designed to help protect against, outside invaders. Most bacteria do not do well in an acid environment. They die fairly quickly. So I think, short of having some sort of open lesion, it's probably not likely. I have had, couples I've worked with where one person got Lyme and then somewhere down the line their partner got Lyme. They're convinced it was sexually transmitted. Was it sexually transmitted, or was it just because you live in the same environment and you just happen the other person happened to get their own deer tick? So I kind of err on the side of caution because we don't know. So I recommend generally if one partner has Lyme that they use barrier protection, particularly during any kind of intercourse, just to make sure because we don't really know. But it's unfortunately something that has not been studied nearly as much as it should.
So it's spring and this is starting, tick season and Lyme season, I guess. And so in terms of people, how would they know right away? What are there, just for people listening, and so they can prevent things, not, they don't have to wait a year. And what percentage of people do get the bullseye, early on? Like what?
The bullseye rash is pretty funny because the CDC on their website they say that upwards of like 80% of people get the bullseye rash. If you look at the research suggests it's probably somewhere around 40%. And those of us in clinical practice will tell you it's less than 20%.
Wow,
To be
really?
honest, out of the maybe in my practice, 5%, if that, have had the bullseye rash. The other thing with Lyme is that, these ticks tend to go to sort of the dark, moist areas of your body. So when I had Lyme disease, I got bit on the back of my left leg. I didn't see it. Someone else found it. So, if I was living by myself, I never would have ever known that I had it. So, it's possible that you could have that bullseye rash, but if it's an area you don't look at or don't see, I had one patient that we found that they had a bullseye rash, but it was in their scalp. And so we had to kind of peel their hair back to see the ring. So again, with a full head of hair, it was almost, well, it was very difficult to see. So, again, it's possible that people do get the rash and they don't see it, or it's possible they see it and it just gets ignored and blown off as, something that's not important. Unlike, other insect bites, when you get bit by a mosquito or a lot of these other stinging insects, you feel the bite, it's painful, it's itchy, it gets raised, it gets red. You know, ticks have a little bit of anesthetic in their jaws. When they bite you, you don't feel it. And the rash tends to be flat and not raised. So any kind of flat spreading rash, when I first got bit and I saw my rash, it was probably about, maybe about 3 or 4 inches in diameter. And by the time it finished spreading, it was almost 18 inches in diameter. It had taken up the entire back of my leg. So that's very classic for that Lyme rash is it tends to spread over the course of several weeks. So any kind of flat spreading rash, again, can be a sign of Lyme. There are other skin rashes that are related to Lyme that are not the classic bullseye rash. Sometimes they're just a red kind of splotchy rash. And I've seen a bunch of rashes that, are not bullseye rashes that are associated with Lyme. So again, it's a great marker for people who do get it. We definitely know that you've had that exposure, but the lack of that bullseye rash certainly again doesn't preclude the possibility of having one.
And how soon do you feel the symptoms?
People can feel it within a matter of days. It can actually take up to several weeks before you become fully symptomatic. So it could be anywhere from 3 to 30 days after the tick bite. I think the majority of people with sort of acute Lyme disease probably feel it within a matter of a week or two. But I'm of the opinion that there are some people that get exposed to Lyme at a point in their life where they're healthy, their immune system's healthy, and they really don't get symptoms. And then something comes down the line where their immune system tanks, and then we start to see symptoms surface. Now, there's no way for me to prove, when they had that exposure just based on the timing and the history of where they lived or where they spent time relative to when they got symptoms. Again, I think it is possible that you could get exposed to Lyme, not get symptoms immediately. And then, somewhere down the line, when your immune system's compromised, you start to get symptoms come out. I kind of think of it a little bit like shingles. You can get chickenpox as a child and then 40, 50 years later get shingles. And it's literally the same virus that's been in your body for all of that time. It's just your immune system kept it in check. And often people get shingles on the heels of some sort of stressful event that compromises their immune system. So I think Lyme is kind of the same way that if your immune system's healthy, you get exposed, your body deals with it, and you may never become symptomatic. But if you're already compromised to any degree, then that infection can take root and create a lot more problems.
Wow. So just everybody listening, more reason to do all your daily practices, all your stress reduction, all your healthy eating. And, it's going to have so many benefits. But that's just really interesting that somebody could have something from years ago. Not, and again, as I said, I'm always looking for root causes because I see so many people who have, no one been able to figure it out and what's going on. And they're just, they're really miserable with chronic pain and all sorts of things. So this is certainly something people need to look into. How prevalent do you think Lyme is?
Well, if we look at the latest research, we estimate there's about 476,000 new cases of Lyme disease every year in the US. That's probably underestimated. So is it 500,000? Is it a million? I mean, we don't really know, but you can imagine it, even if we take that number at face value, 476,000 new cases a year. That's now, you think about, do the math. I mean, every year that number keeps growing and growing. So Lyme disease is the fastest growing infectious disease in the world. And it affects millions of people. It's found on pretty much every continent. So it's not unique to North America or the United States. They've got it in Europe and in Asia and in Africa. So it's a worldwide problem. And the World Health Organization actually came out with a report several years ago, basically suggesting that climate change was driving a lot of this. The fact that, we do have warmer temperatures, things that, used to kill off ticks, like, even in, when I lived in Connecticut, from the time I moved there in about 2000 to the time I left in 2018, I noticed that, winters were getting warmer. We didn't get as cold, didn't get as much snow. Well, the cold kills off the ticks. And now they're finding that the ticks are able to survive the cold. It's not getting cold enough. They just kind of burrow under the leaves and the branches and they'll sit under that snow cover. And then once the snow melts, they start repopulating. And also, we know that the birds are migrating away from their normal migration pattern. So, birds, ticks get on the birds, bird flies somewhere else, then lands wherever else. Now that tick hops off and it kind of starts a new population of ticks in that area. So, the CDC has a map looking at, the prevalence of deer ticks from, 20, 30 years ago to, now. And you can see how it's just kind of started, in New England, the central Midwest, and now the East Coast and West Coast of the United States are covered. It's all pushing inwards. And that's why I said earlier, you can really get this now just about anywhere because these ticks are found in a lot of states that we didn't used to see them.
Wow. Is there anything we could put on our skin? Any protection that you
Yeah, so
recommend?
yeah, if you're gonna be outdoors, particularly in areas where the Lyme is endemic, long clothing is your best protection. Long pants, long sleeve shirts, tuck your pants into your socks. Ticks, don't easily, burrow through your clothing to bite you. Their jaws aren't that long. So long clothing is very helpful. And then there are some great natural essential oil sprays that have been shown to be effective as a natural tick repellent. So there's a company I like called TikTok Naturals, based out of New York, and they have a really nice essential oil spray. The nice about essential oils too is they're safe to put on your clothing, safe to put on your skin. Unlike things like DEET that they typically use as a tick repellent, if it gets on your skin, it can be very toxic, particularly for children. You don't want to use these kind of toxic chemicals. So, at least with the essential oil sprays, you can use them as often as you need them, and they're at least safe to put on your skin.
Oh, well, that's a huge tip.
And of
And
course, doing a tick check when you get in, again, particularly for kids, who might have been out, rumbling and tumbling on the grass and playing in the woods or whatever they're doing. So when they get in, strip them down, look in all the cracks and crevices and just get in the habit of doing regular tick checks when you're outdoors just to help, identify, that tick early. And if you find it, you always want to try and save the tick. So you want to keep some fine tweezers, pull the tick out very gently, put in a little Ziploc baggie. And again, there's several labs out there that can test the tick. So if you did get bit by the tick and it's still attached to you, you can send it off to one of these labs. There's one called tickreport.com, and then medical diagnostic labs also will test the ticks. And that way we can find out, did the tick carry anything that we need to be concerned about?
and if it did, if the child's perfect or if you're perfect and it did, is it just something to know for future? Do you treat it right away or
Well, if it's an acute tick bite, we always err on the side of caution because we know the early treatment, can prevent someone developing any type of chronic illness. So we treat until proven otherwise. So if someone has a tick bite and if we know it's a deer tick, we will treat until the tick's been tested and or the person's been tested to see did they actually get the illness. And in which case it can be several weeks for your body to make antibodies anyway. So often we do put people through a course of treatment, but we're better off, erring on the side of caution and treating prophylactically because again, that can help prevent a lot of problems down the line.
and do you use herbals then in your prophylactic? Is that how you typically?
I do mostly herbs, but there are some people who, for whatever reason, they want to use antibiotics. And again, if it really is acute Lyme disease or an acute tick bite, again, I think that's where antibiotics are appropriate.
Got it. All right. So you've created something really wonderful that's coming up. I'd love your master class. Do you want to just tell us a little bit about this? Because everyone who's listening, this is happening pretty soon in May.
Sure. Yeah. So I developed a class for practitioners related to Lyme disease, and we felt the information was so valuable for people with Lyme disease. So we're going to launch this class towards the end of May, and it's going to be an 8 module class where we just kind of walk people through all the aspects of Lyme disease from diagnosis and testing and diet and gut health and herbs, and so it's really kind of a step-by-step guide of, how to help manage and overcome Lyme disease. So if anyone listening is dealing with Lyme or any other kind of tick-borne illness, or if you know someone who has, we'd love for people to sign up for the class. I think it's going to be an invaluable resource for folks and really helping, understand more about what's going on with Lyme and finding those tools to overcome it.
Okay, great. And I'll have all the information about that. So what did we leave out? Is there anything that you else you want to share with everybody that we may not have brought up yet?
Well, I think when it comes to Lyme, I find, sometimes being the squeaky wheel is what gets things done. So, again, if you've been someone who's been living with sort of this collection of symptoms that no one's really been able to explain, again, particularly if it involves any kind of joint problems and particularly neurological issues, there aren't too many things that mimic that. So Lyme and these other tick-borne illnesses should definitely be ruled out. So if you've been to your doctor and you ask about it, and if they're dismissive of you, again, find a practitioner who's willing to do that work with you because it's just such an important thing that it creates so many health problems for people. And if you can get the right diagnosis, now you can apply the right treatment and get you on your road to being healthy again.
And have you seen that? Have you seen people that, 5, 10 years? Is that common that people have had symptoms and just were misdiagnosed?
Oh, I've had patients for 20 plus years that went undiagnosed. And particularly for some of my older patients where, maybe they got infected in the 70s, the early 70s. Again, we didn't, figure out Lyme disease until the early 80s. And even then, it was still really not known. So for anyone who might have had that exposure earlier, uh, no one knew about it. No one, there was no test for it. And yet they had these collection of symptoms that went on and on and on. And again, on paper, they kind of looked okay. So, for anyone who's had, these long-standing symptoms that really no one's been able to figure out, it's at least worth ruling it out.
Oh, this is just so important. And it'll be interesting how many people, I mean, that's why I love doing the podcast, because there will be people whose lives will be changed from listening to you and maybe working with you or coming to your masterclass. And, just not, all this information isn't out there. So it's really wonderful that you've delved into this and you've done so many things in your book. And it's just so great. So I can't thank you enough. I'll have all the links to everything in the show notes, but it's always a pleasure. I haven't seen you in person. What did we decide? It was 4 years ago, I guess.
Exactly.
Yeah, you hadn't moved. You were still living in Connecticut, so it was a while ago.
Hopefully now that the world's opening up again, we'll all get to see each other in person again.
Absolutely. Well, it's always a pleasure. So it's great seeing you. And thank you so much for sharing all this wonderful information with everybody.
Great. Thank you, Margie.
I hope you enjoyed my interview with Dr. Darin and now have a better understanding of Lyme disease and why this is something we must pay attention to. It could be the root cause of an underlying autoimmune condition. It could be affecting your bones and so many other areas of your health. So all the links that Dr. Darin talked about will be in the show notes, including the link to his masterclass. So if you or anybody else is interested, I would strongly recommend pursuing this and seeing if this is something that can make a big difference in your health. So thanks so much for tuning in, and I look forward to seeing you on future episodes.